As at 9 o'clock this morning, there have been 15,418 positive cases confirmed, which is an increase of 18 since yesterday. A total of 1,046 patients are in hospital with either confirmed or suspected COVID-19. That represents a total decrease of 27 from yesterday, including an increase of 3 in the number of confirmed cases. A total of 27 people were last night in intensive care with confirmed or suspected COVID-19, and that is the same as the figure yesterday. I'm also able to confirm today that since the 5th of March, a total of 3,695 patients who had tested positive and required hospital treatment for the virus have now been able to leave hospital. Unfortunately, in the last 24 hours, one death has been registered of a patient who had been confirmed through a test as having COVID-19, and that takes the total number of deaths in Scotland under that measurement to 2,363. The fact is, the virus is being suppressed, but it has not gone away, and it is still extremely dangerous. Indeed, a route map out of lockdown expressly recognises that during phase 1, which of course we entered on Friday, there is still a high risk that the virus is not yet contained. However, it's also clear that over the weekend not everybody stuck to the rules. I'm told by the police that on Saturday alone there were 797 dispersals, and that is people being moved on for not complying with the rules. And to give some context to that 797 is 5 times higher than the figure the previous Saturday. And there were also clearly cases where, despite the guidance we issued, people were driving more than 5 miles to beauty spots. In some cases, we know that people were staying overnight in tents, caravans or motorhomes. Some of the early statistics we have from Transport Scotland also give us some cause for concern. Overall, transport yesterday was 70% up from the previous Sunday, and transport on Saturday was 60% up on the week before. In some places, Loch Lomond and Glencoe, for example, the increase was even more dramatic than that. On Saturday, on the A82 by Loch Lomond, traffic was around 3 times higher than it was the previous Saturday, and we saw a similar picture around Glencoe. So I'm going to be very blunt here. It is very hard to see how all of that can have been caused by local residents or by people travelling a reasonable distance to meet loved ones. So we will be considering all of this as we continue, as we must do, to assess the impact of the phase 1 changes. In fact, I have a duty to be clear with you that if there is continued evidence of even a minority not abiding by these guidelines and travelling unnecessarily, if people meet up in larger groups or if they're making journeys which risk spreading the virus, we will have to put these restrictions on group size and travel distance into law. And we won't hesitate to do that if we think that is necessary for the collective safety and well-being of the population. The fact is, unless you're an essential worker or work in one of the categories now permitted to be at work, you should still be spending the majority of your time at home. You should still be seeing far fewer people than you might normally do. And those meetings you are able now to have, and your life more generally, all of our lives more generally, should still not be feeling normal. But I want to say very directly to young people, this virus can still be very harmful to you. Even if you yourself are not adversely affected, you can still pass the virus on to other young people, including your friends, and then some of them, of course, may pass it on to others, for example, parents or grandparents who are at a greater risk of becoming seriously ill. The fact is, all of us want to be able to lift more restrictions so that we can meet friends and family in much more normal circumstances. We want to be able to restart NHS services, as the Health Secretary talked about yesterday, and to allow people more generally to get back to work, school or study. But we can only do this if we keep driving down the overall level of COVID infections and if we continue to suppress the spread of the virus. And we will only do that if all of us continue to stick to the rules.